what's the difference between inline flow and outline flow, and why is it important? Because her doctor said that he got inline flow, going great above the knee, did a small bypass, but then she still had pain afterwards. Weeks later, went back to the doctor, and the doctor said, well, you have great inline flow, but you have bad outflow, but there's nothing we can do about it. So go home and walk, walk, walk. And when you have too much pain, you can't deal with it anymore, we'll just go ahead and amputate.
Wow. I would say that when I use the term inline flow, I generally am describing drawing a line from your heart directly to your foot. That's what inline flow is. Any cutoff of blood flow above your foot inhibits you from having what I would describe as inline flow. So you can never say someone's got inline flow to their foot if they have blockages. So I think that that's just my interpretation of what that is, right? So you can have inline flow to the level of the knee, right? Which to me means you have blockages below the knee, which affects the surgical decision making or the endovascular therapeutic decision making you have, because the goal is to get blood flow to the foot. You know, it's I'm just a little confused.
I know. I mean, some of the things, a lot of doctors, Dr. Renata Duwa, she's on my board of directors. And for a long time, I would share with her some of these questions and things that were happening and things that doctors would say. And she's like, oh, that's just a one-off. That could, then the patient probably misunderstood. But like this one, she sent me the email. It was like, that is basically what the doctor said. There's nothing, it's an outflow problem and there's nothing we could do. But describing it as, above the knee looks great.
Yeah.
Not talking about anything below here.
Now that there's like,
no outflow.
People have desert feet, meaning that they're, for whatever reasons, due to their underlying comorbidities or exposures to toxic materials, if they grew up outside the United States, like they can have the obliteration of blood vessels below the ankle. Right? There's certain conditions like Berger's disease can cause that. And in those patients, they have no outflow. They can have inline flow to the level of the ankle, but then they have no blood flow in their foot. And these are the types of patients we talk about deep venous arterialization in. These are the type of patients we talk about putting nerve stimulators in to help promote the small blood vessel capacitance and carrying blood flow to the toes and stuff like that. And we talk about heart assist. There are a lot of different strategies we have, but yeah, it's just so tough to hear that patients are experiencing that. But at the same time, I'm not that surprised.